Welcome to the world of health.
Lyudmila Maza grew up in her native village of Vasilkov, not far from Kiev. She graduated from school and went to work in the regional agronomic supervision. The girl combined the work of a laboratory assistant with studies at an agricultural technical school. Soon Lyudmila entered the university.
I was appointed chief agronomist. Everything was good in my life. I was still studying at a university. Suddenly, I felt a general weakness of the body due to stress. A manifestation of general weakness of health was that I could not do anything at home. I couldn't clean the apartment, I didn't want to do anything, I always wanted to lie on the bed. I was constantly tired and could not work. And then my eyesight began to deteriorate sharply. When my vision began to deteriorate greatly, I went to the doctor at the hospital.
My patient Lyudmila 2 years ago turned to an ophthalmologist. She started having big vision problems. Her vision lost clarity, she could not focus her vision and wrote only in such large letters, because she simply could not read and write small letters. Lyudmila was examined by an ophthalmologist, and the doctor came to the conclusion that this is not an ophthalmological disease, and she needs to see a neurologist. The examination was carried out on April 19, 2006. Lyudmila complained of headaches in the frontal region, her neurological status changed. A blood test was carried out to detect torch infection, cytomegalovirus and herpes virus. A chronic cytomegalovirus infection was detected, and a course of treatment was prescribed. Then they did magnetic resonance imaging, MRI showed foci of neuroinfection. Doctors discovered inflammation of the optic nerve, and then diagnosed multiple encephalomyelitis.
The woman was admitted to the clinic, examined by ophthalmologists and neurologists, but her condition began to deteriorate sharply.
I could no longer walk on my own. Severe swelling appeared on the arms and legs. My shoe size has increased by 2 sizes. I couldn't wear shoes because my legs grew. I had a bad headache. My body was constantly rocking from side to side. Of course, poor eyesight worried me the most. My vision deteriorated very quickly.
Such symptoms of the disease, which Lyudmila Maza had, speak of multiple sclerosis, a chronic disease of the central nervous system. Basically, this disease affects young people from 18 to 40 years old, but recently, childhood forms of multiple sclerosis and multiple sclerosis have appeared in the elderly. In Ukraine, more than 18,000 people suffer from multiple sclerosis, and their number is constantly growing. During 2006, Lyudmila Maza was treated in hospitals in Kiev. She received injections of vasodilators, prescribed various procedures, but the treatment did not help. The girl had to quit her job, but still graduate from the university. A year after the onset of the disease, Lyudmila's mother got a newspaper with reviews of people who had been treated by Gadget Avakyan, many of whom claimed that after many years without successful treatment with traditional medicine, they turned to Dr. Avakyan and began to recover. Lyudmila's family also decided to try Gadget Avakyan's treatment.
I just had no way out of the situation. I realized that other doctors couldn't help me anymore. My mother said, "Let's try Dr. Avakyan's treatment." In the end, his treatment helped other people and they recovered.
Lyudmila immediately called the Kharkiv center of Academician Avakyan and told in detail about her illness. She ordered an intensive course of treatment. A week later, she was sent a course of treatment with bionormalin and immediately began treatment. The first results of the treatment appeared within 2 weeks, and Lyudmila's health began to improve.
I went through 3 months of treatment. This was in February, March and April. I felt a significant improvement in my health. Before the treatment, my hands and feet were constantly freezing. There was a feeling of warmth, the warmth passed into the arms and legs. The swelling of the legs disappeared. The irritability has passed, has ceased to be nervous. This is only the first course of treatment with academician Avakyan. Most importantly, vision began to gradually recover. The vision became clear.
Lyudmila was getting better and better. She began to get better. She had a desire to live. The girl decided to go to a clinic in Kiev and undergo a second examination of her condition. During the examination, the doctor was pleasantly surprised. The data of the magnetic resonance imaging showed that there were no new foci of inflammation and the old foci had decreased. And that meant stopping the disease.
I looked at her tests and examination results, no disease. The residual symptoms of the disease are simply minimal.
Lyudmila's health condition allowed her to return to work, and she returned to her former place of work. Now she is a healthy person. She works as a chief agronomist on a farm.
I am grateful to Gajik Avakyan. This doctor restored my health, healed me. There are many patients like me, and we are all grateful to Dr. Avakyan. Bionormalin, a treatment that